Hi, I'm Dr. Bret Dyer. I'm a periodontist in Sugar Land, Texas. Our practice is Fort Bend Periodontics and Implantology. Primary services would be we do a lot of laser regeneration procedures. So that's if you've had gum disease and you've had bone loss around your teeth, you've probably had an aunt or uncle or some type of relative that's had traditional gum surgery, and after they had their treatment, their teeth were longer and their teeth were sensitive, and in 3 to 5 years they had to have it done again. So the difference between that and what we're offering in the office is laser regeneration. So with laser surgery, there's no incisions with the scalpel. There's no bleeding or very little bleeding at the time of surgery, and no swelling after surgery. And so what that means to the patient is it means if you don't have swelling, you don't have pain. And because the laser incisions are so small, it's such a minimally invasive procedure, you don't get recession after these procedures. In fact, we typically correct it. And so the experience is so much different. With a traditional type of dental surgery, you're going to be recovering from that type of procedure for a week or two. And from a laser type of procedure, it's hard to tell where I've done surgery the day after I've done it. And so it looks better, doesn't swell, and there's not pain associated with it. And so that's a huge advantage to using lasers, especially the cold lasers, or the lasers that don't create damage in the soft tissues. Other typical procedures for us every day are we do something called the Pinhole Surgery, which we do this every week, several times a week. And that's for patients that have had gum recession, and maybe they know someone, or they've even had themselves, this happens all the time, they've had some type of connective tissue grafting done in the past and it failed, or the results weren't quite what they wanted. And that type of procedure, the tissue's harvested from the roof of the mouth, and then it's placed somewhere where there's gum recession, and the wound healing from that is pretty extensive. With a pinhole procedure, all the surgery is done through a pinhole, so another minimally invasive surgical procedure. And typically we'll have the patient come in 24 hours after we do the surgery, and it's not unusual for a patient to have taken Advil the first day, maybe the second day, and that's all that they're going to need. You can see your results starting immediately after surgery. So it's a minimally invasive, it's not painful, and it's just the next stage in successful grafting today. Other procedures we do quite a bit of are dental implants. We place around 400 or so a year, and so if you're missing one tooth or several teeth, today we can replace those teeth with dental implants. And if it's in the anterior area, we typically can replace the teeth and put temporaries on there the same day. If it's for posterior teeth, then typically we're placing the implant, and then the crowns would be placed later. We work with a lot of referring dentists in this area, and so we don't do the crown portion of the teeth, the final crowns. We'll do temporaries and things like that the day of the surgery. For the final restorations, we'll either send you back to your general dentist, or we'll refer you to a general dentist that we work with. And so grafting, regeneration, dental implants, those are really common procedures in our office. We also treat a lot of headache patients. It seems like today stress is an aspect of everybody's life, and lots of people are taking pills every day to control their headache pain or tension pain in their joints or around their ears, or right in the temples or behind the eyes. All those areas that you would get a headache are stress headaches most of the time. Even migraine headaches. Migraines tend to have triggers that set one off. And today we do a lot of treatment for headaches, migraine headaches, with both physical therapy, also using Botox. We'll use Botox to relax the muscles of the face and then the head and the neck and shoulders. We'll use different types of appliances to make it where you're not clenching and grinding so hard. And a combination of all those approaches to eliminate those problems for patients. It starts off as it does in every office with a doctor and a patient. We try to get to learn our patients' concerns and their needs and their desires. But when you start with me, at least in this practice, our goal is not only to get you healthy again, but it's actually to keep you that way. And so I have lots of patients that have been with me for 10 and 20 years, and so they become a friend of the practice or a friend of the family. You know, I've seen patients grow up, and I've seen patients age, and have taken care of them through the whole process. Today, you do have a lot of choice. There's a lot of corporate dental offices in America today, and especially in Houston, the greater Houston area, and a lot of traditional insurance practices, and they tend to be limited by the insurance plan. They offer you just what insurance will pay for, and so you get treatments like traditional osseous surgery. It's been on the market. People have been practicing it since 1949, and it hasn't changed a great deal. And so today, still the most common surgery you would get in a periodontist office is osseous surgery with a scalpel, and you end up with gum recession, you end up with tender teeth, longer teeth. There are true advantages to having treatment done with modern techniques in a minimally invasive format. And on top of that, it's not any more expensive than you would get if you went to your practice. It's an all insurance practice, and in fact we take all insurances, but we have this technology, we have this expertise to make this experience where it's not something that you're going to dread before, during, and after.